The radius now it will be 1, 3, 3, 2. What is 1, 3, 3, 2? 1 attached to the radial tuberosity, which is biceps. 1 attached to the radial tuberosity, which we called it biceps. So what about 3, 3, 2? 3 anteriorly, and 3 laterally, and 2 attached to the posterior border. So again, 3 anteriorly, 3 laterally, and 2 attached to the posterior border. So what will be the 3 anteriorly? What we have? Flexor digitorum superficialis, flexor pollicis longus, coronator quadratus. Again, like in this diagram, we have here flexor digitorum superficialis, flexor pollicis longus, and coronator quadratus. This area. Okay, this line only flexor digitorum superficialis. All this flexor pollicis longus, and this coronator quadratus. Laterally, what we have? Supinator, pronator teres, and brachioradialis. Supinator, pronator teres, and brachioradialis. And what about the posterior border? We have only 2. We said 1, 3, 3, 2. What is 2? Here it will be abductor pollicis longus, and here it will be extensor pollicis brevis. Do you remember the abductor pollicis longus and the extensor pollicis brevis, which was the posteromedial aspect of what? Of anatomical stump box. Here. So they are running where they were coming already from the posterior border of radius. Abductor, yes.
So this, the medial side was 2 tendons and
one, yes, laterally. Here we have 2, here we have 1. This extensor pollicis longus, but here we have extensor pollicis brevis and abductor pollicis longus. Do you remember when we drew it as well? So this, it will be the structures of radius. Now let's talk about ulnar. This ulnar, like this. So what we have? Upper end, lower end, and shaft. Upper end, it's formed by what? This we call it what? Trochlear notch or ulnar notch, by the way. Trochlear notch or ulnar notch. Why? For articulation with trochlea of the humerus, like this, to form what's called elbow joint. To form what's called elbow joint, together with the radius. Radius and ulna and humerus forming elbow joint, but wrist joint only between radius and carpal bones. Radius and carpal bones. So this trochlear notch. What this process? Coronoid process. What this process? Olecranon process. Very good. Coronoid process anteriorly, olecranon process posteriorly. What else? Anteriorly here you can find rough area. We called it ulnar tuberosity. For what? We said this now? Brachialis muscle. We have B and B. Biceps on the radial tuberosity. Here, brachialis. Radius for biceps. Ulna for brachialis. Radius for biceps, ulna for brachialis. Both of them, they are very close to each other. And both of them, they taking tuberosities. Here it's called radial tuberosity, here it's called ulnar tuberosity. What else? Laterally here we have this, which is, what this facet? Radial notch of ulna. Radial notch of ulna. And down to this facet we have supinator fossa. This area. Supinator fossa for supinator muscle. And can you see this ridge? Supinator crest. So we have supinator fossa, and here we have supinator crest.
What is the fossa?
All this area, all of the triangular space here. Can I take this pen, please? Thank you. So look at this. All this, supinator fossa, but only this ridge, which is supinator crest. Supinator crest, where both of them down to this area, which we called it radial notch of ulna. Radial notch of ulna. Okay? Then we have the lower end. Lower end, it has only head and styloid process. Head, which is lateral, but styloid process, which will be medially.
Why is it called supinator?
Because it has, yes, supinator muscle. This area which has supinator muscle, that's why we call it supinator fossa. Supinator fossa and supinator crest because it has supinator muscle.
It originates from the ulna?
Yes, it takes, and attached here. Yes, very good. Supinator, it was a very small muscle for making supination. What else? We said the lower end, it has head and styloid process. So can you see the only bone which has its head downwards? The only one which has its